Well, the federal government is launching a national strategy looking at men's and boys' health. To talk about it today is Dr. Matthew Tenenbaum, the Associate Medical Officer of Health at Wellington Dufferin Guelph Public Health. Thank you for joining me, Dr. Tenenbaum.
Thanks very much for having me today.
Well, first off, the federal government launching that national conversation, which will help develop Canada's first men and boys health strategy. What exactly does that mean for men and boys in this country?
So I think what it means is that the federal government is going to be trying to take a strategy that will help focus on the needs of young men and boys as they exist in the country today. Obviously, the world is changing, times are changing, and maybe needs that are not being adequately met. And I think the goal of the strategy is to help make sure we understand what those needs are so that our health system can address them appropriately. I know the federal government's announced the strategy is going to be in development. They're looking for some input from the public over the next 3 months or so. And hopefully the outcome, the strategy that's developed as a consequence, is going to be useful to men and boys, as well as the entire community.
Yeah, I know it's still being developed, but the strategy is being applauded by mental health advocates who say it's long overdue. Locally, how is mental health addressed for men and boys? And how could this help?
So we know from data that we can look at nationally, provincially, as well as locally, that there's different ways that men and boys versus women and girls experience health. We know, for example, that about 70% of opioid deaths nationwide are in men as opposed to women. We know that men experience shorter life expectancy, higher rates of premature death, increased problems around things like suicide and gambling, substance use. So there's different kinds of health risks for men and women. I think this strategy helps create an opportunity for us to focus in on how some of those risks are experienced by men and boys specifically.
You kind of mentioned it, but Canadians can now provide feedback on this strategy. But what kind of things are professionals looking for input on?
So I can't speak exactly to what is most relevant to Health Canada, but I think they're looking for certainly organizations and experts to provide their input from a place of knowledge to say, here is where it's worth focusing on, here are the kinds of health issues or the kinds of dimensions of experience that people are having. But I know that they're also looking for input from the public, and I understand there is a questionnaire or a survey you can fill out. So if you or someone near you is someone who feels strongly about this issue, you as a member of the public can still add your input, make your contribution to the strategy, hopefully ensuring that it reflects the broad needs of our society overall.
Yeah, I guess speaking of society overall, I know this is focused on men and boys, but how could this help society overall?
Well, I think that even though the strategy is focused on men and boys, it's not just about them, in the sense that anytime we have identified a particular group of people in our community who have particular needs, I'm of the opinion that we are all better off when we understand those needs and address them in a way that makes sense. So it's in everyone's interest to have a men's strategy. It's in everyone's interest to have a women's strategy, which I know we've had since about 1999. And anytime we find a particular group of people who are distinct, who have particular needs, it is worthwhile for us as a health system to understand them, think about them thoughtfully, and try to develop strategies that are tailored to what we've learned to make sure we're meeting the needs as they exist. Not everyone's going to have the same experience, but the more we understand the needs of different individuals and groups, the better able we all are to live our best health and contribute most to society around us.
And when we're speaking about mental health issues, what kind of struggles are there with staying silent about it?
Well, we know that people experience mental health differently between men and women, boys and girls, and also people have different ideas about what they feel comfortable sharing and how they can seek help for that. We know, for example, that men statistically are less likely to seek health care for some of these kinds of concerns than women. So it does affect their ability to get the kinds of help they might need, which may be a contributor to some of the data we're seeing around things like substance use and suicide, unfortunately. We also know that even just in our society overall, there is stigma around some of these mental health concerns, and men might experience that stigma in particular kinds of ways because of the gender norms that exist. It's worth thinking about those things and kind of taking an intersectional approach, thinking about how men in particular experience that, because that will help us develop and implement the best possible strategies.
Very interesting developing ideas for this strategy. Thank you so much for joining me, Dr. Tenenbaum.
Thank you very much.